Okay, so early in the process, we did realise that there were two major places that would be affected by the temporary removal of general surgery, and those were the emergency department and the obstetrics and gynaecology team. So based on that, we had discussions with the local team, with the clinical lead who looks across the services both in Altnagelvin and in South West Acute Hospital, and we reached out to a local representative of the Royal College of Obstetrics and Gynaecology. They did discuss with both teams, and they came up with a series of 3 recommendations. The first recommendation was that we had to have availability of 24/7 middle grade surgeons to attend South West Acute Hospital at short notice if there were any difficulties while an obstetrics and gynaecology consultant was carrying out a caesarean section. So that we've done. We have a stable team of 4 doctors, and they're in place. The second thing that they asked us to do was to ensure that we had adequate transport. That would mean that we would have increased capacity above what NIAS normally give us to transport patients out on a safe basis. And the third thing they asked us to do was to risk stratify. So for example, it's not actually obstetrics that is a problem, and this is a comment that is coming from directly the lead doctor in obstetrics and gynaecology in South West Acute. Obstetrics is not the issue, it's more complex gynaecology. So there is a small impact in gynaecology in that some of the more complex cases would be better carried out in Altnagelvin Hospital because we have more availability of general surgeons. But it's a very small area, and it doesn't impact at all on maternity services.